Hi, my name is Freya Bajaj, and today I'll be talking to you about sexual education. Just to introduce myself, I'm a rising junior at Gilbert Classical Academy here in Gilbert, Arizona. I'm very involved in music. I like collecting vinyls, going to concerts, and I play the trumpet in the Phoenix Youth Orchestra. I also volunteer at my local hospital, and I've done so for about 2 years now. I'm part of a national mental health organization called Bring Change to Mind, where we work to reduce stigma around mental health. I was on the regional board, and I'm vice president of our school's chapter. I'm also proud to say that I'm going to be junior class president, and I'm really excited to make some real change at my school. Last but not least, this last summer I did a research fellowship at University of California, Irvine, where I worked under Professor Lotfapor to research the effects of nicotine on subsequent drug use. I'm really interested in continuing my path in research as well as going into medicine while still being involved in public health. Sex ed is important because it's a global issue. There are 21 million pregnancies per year in adolescents aged 15 through 19. That's a huge number. And even bigger than that, 230 million girls and women alive today have undergone female genital mutilation. The World Health Organization says that sex ed reduces risk from violence, exploitation, and abuse, making it the first step forward to reducing these numbers. So what even is sexual education? Sex ed encompasses a large variety of topics such as puberty, STIs, pregnancy, prevention, sexual orientation, and consent. I did a survey in my high school to see what students in my community are saying. I asked if they had ever received any form of sex ed at school, and the majority said no. Then I asked which of the following topics recommended by Planned Parenthood had they not been taught at school. And again, for each of these topics, the majority said that they had not been taught it, with only 2 people saying that they had been taught every single topic recommended. I also asked if they knew where to access reliable information about sexual health, and 70% said no. These are very concerning statistics, showing that even in a small, tight-knit community, people don't know where to access reliable information. So what do students really want in sex ed? I could sit here and tell you what I think should be included, but it's not as impactful as what students in my community actually want and will listen to. With the most popular topics were consent and pregnancy prevention. So what needs to change? Obviously, sex ed should be much more widely available for students, but I think the first place to start is by fixing the sex ed curriculum already offered in schools. It needs to be more medically accurate, LGBTQ plus inclusive, consent-based like a lot of the students in my community wanted, and age-appropriate and emotionally sensitive. What this means is that a kindergartner doesn't really need to know about pregnancy prevention or STIs, but what they might need to know about is hygiene, puberty, sexual orientation. And as they get older, these more sensitive topics can be introduced to them. Now here's what you can do. As a student, you might be like, Freya, this is great. I understand how important and pressing this issue is, but is there really anything I can do about it? There actually is. You can speak up about what's missing. Just by talking about it and bringing awareness to this issue, you can make a bigger difference than you think. You can also share resources. Some of my favorites are Planned Parenthood and Amaze.org. By having these resources for yourselves and by sharing them with your peers, you can make sure that you and your friends are safe. You can even start advocacy groups. This is a great way to share your ideas about anything. For example, in Bring Change to Mind, we have meetings where we have open conversations about what students might need from us or even the school, and we always push them to go to the mental health counselor if they have any issues whatsoever. Parents, you can start open conversations with your kids about these kinds of topics. They need to know that they can go to you when they have issues surrounding these topics. And by using reliable resources like Planned Parenthood or Amaze.org, you can make sure they have all the information they might need. These resources even have video tutorials for parents to be able to start these conversations more easily. You can also push for policy changes at schools. My school doesn't offer sex ed, and that's because parents in our district lobbied against it. But hopefully now you understand how important it is that you should push for policy change at your kid's school. As a teacher, you can advocate for more inclusive sex ed. You can make sure that it's LGBTQ plus friendly and it's consent based. And you can also ask for anonymous input. You may not know exactly what students want or what they'll listen to, but by doing anonymous input, you can make sure that you build a safe, open classroom culture that can help students feel comfortable talking to you appropriately about what they might need or what they might not be able to talk to other students or their parents about. And if you're not part of any of these categories, you can still make a difference by sharing resources and talking more openly about sex ed. Just by being a compassionate human being, you can make more of a difference than you think. Thank you.